Hi, welcome. I'm Vivian Brown, the editor of the Bear News, and this is a Bear Moment with Sheriff Susan Parmelo. Sheriff, thank you so much for joining me today. I really appreciate you taking the time to sit down. Let's jump right into it, shall we? $2.3 million is spent annually on the 800 inmates with mental illness to provide treatment, medication, counseling, and assessment. Recently, Bexar County was touted as a beacon of success for treating our mentally ill. Last week, in a Senate Judiciary hearing, you testified that the cost of incarcerating these inmates is not merely financial. Can you explain what you meant by that?
You know, these are individuals who often need treatment rather than being jailed. And what I talk about in terms of not just the financial cost, but it's the cost in human capital. One of the examples that I used last week in my Senate hearing testimony was about a man by the name of Kenny. He's 60 years old. He's been in and out of jail just in 2015 14 times. And it was because of minor misdemeanor crimes, but he's homeless. He lives at the door to a grocery store because he thinks he belongs there. And he's been arrested for criminal trespass. We know that he's been diagnosed with schizophrenia, but he doesn't want to take his meds. He needs treatment and counseling, not jail time. Yet he's in that cycle of the criminal justice system. And what we know is that of the about 20 to 22% of everybody who's in the Bexar County Jail today, that they have some level of diagnosed mental illness. 60% of those, and in real numbers, we're talking about over 400 people, have been in and out of our jail 6 or more times. You know, so the cost of just housing them doesn't move them toward wellness. And we know with treatment, with counseling, with rehab efforts, because 80% of those with mental illness also have co-occurring substance abuse issues. And so it's working with the individuals in a case management approach, as is done in a number of our specialty courts. And kudos to the courts and to our judges who have taken this on. You know, when someone goes to court, often, if they are eligible for a program like this, they're entered into a program with the drug court, the DWI courts, the misdemeanor mental health courts, or the veterans treatment courts, so that over a period of time, there's a very rigorous program that helps that individual return to society and be a productive member. And that's really what we want, because we don't want them coming back to the jail. And so when we look at individuals with mental illness, you know, we're really back to the future, because in the 60s and 70s, we used to warehouse people in mental institutions. And there were a number of civil rights lawsuits that were filed in the 70s and 80s, which essentially dumped the mentally ill out onto the streets, but we didn't provide the community resources that was needed to provide treatment for these individuals. And so today, jails and prisons are de facto mental institutions. And we need to refocus our efforts on helping these individuals return to a life where they can be productive and focus on wellness.
Does Bexar County have enough resources to treat the mentally ill before they become in trouble and enter into the justice system?
You know, and that's another issue that our state and locally need to address. The Meadows Mental Health Institute has recently taken a look at the resources that are available here in Bexar County. And even for as good as we are in Bexar County, and as focused as all of the stakeholders have been for mental health, there still aren't enough resources to deal with the issues that we have. And they estimated that there are resources in the community for only 1 out of 5 who have mental illness. It's an issue that, for such a long time, we shoved under the carpet. People are embarrassed about it, but it's an illness, just like a physical illness. And there are ways to treat it, but sometimes we push it under the carpet and don't address it, and we really need to.
I think sometimes there's a stigma with it. Instead of people treating it as an illness, they think this is just somebody lazy, or they haven't, they're just not adapting to society. When people make fun of them being with the mental illness, instead of realizing this is the same as somebody have diabetes or cancer, they didn't choose to have this.
Mm-hmm.
Inmate suicides have been among the highest in Bexar County among the state. Where do we rank now?
Well, I would say that the numbers that some of the news outlets have used go back to 2009. But since that time, in 2013, we had 0 suicides. In 2014, I believe we had 3. And then last year in 2015, I believe we had, it was either 3 or 4, and I don't recall those numbers right offhand. But we train our deputies. We focus on mental illness to make sure we identify individuals who are at risk of wanting to harm themselves. And so, in fact, we have a mental health unit. We have medical units where they are under close observation, both by medical and mental health professionals and our deputies, to make sure that we take everything out of their reach that could be used to harm them.
Excellent.